There is something in your kitchen right now that is quietly damaging your kidneys. You bought it at a grocery store. You probably used it today. And almost nobody talks about how dangerous it can be when consumed the wrong way, in the wrong amounts, over years. Your kidneys filter about 200 liters of blood every single day. They remove waste, regulate your blood pressure, balance your fluids, and keep you alive without ever asking for your attention. But here is the problem. Kidney damage is silent. There is no pain in the early stages, no obvious warning. By the time symptoms appear, you may have already lost a significant portion of your kidney function. Today, I am going to tell you about 4 hidden toxins that are damaging kidneys across the world, including the one that is almost certainly already in your kitchen. And more importantly, I will tell you exactly what to do to protect yourself starting today.
Reassuring. This is not scare content. This is the clinical truth that I share with my patients, and it is information that could genuinely change the trajectory of your health.
My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years of clinical practice. Kidney health sits directly within my area of expertise. As a urologist, I work with the urinary system every day, and the kidneys are central to everything I do clinically. My patients are predominantly men and women in their 50s, 60s, and 70s, and one of the most common conversations I have is about how everyday habits, foods, and medications that seem completely harmless are quietly working against kidney function over time. What I am going to share today is based on real clinical science, published research, and the guidance of major medical institutions including the National Kidney Foundation, the American Diabetes Association, and Harvard Medical School. Let me walk you through the 4 biggest threats to your kidneys that most people have no idea about. Before we get into the toxins, I want to make sure you understand what your kidneys are actually doing for you every minute of every day. Each kidney contains approximately 1 million tiny filtering units called nephrons. These nephrons filter your entire blood supply roughly 40 times per day, removing waste products, excess minerals, and toxins that would otherwise accumulate and poison your body. Your kidneys also produce hormones that regulate your blood pressure, stimulate red blood cell production, and activate vitamin D for bone health. They are not just filters. They are one of the most sophisticated and essential organs in your body. The critical issue is that kidneys do not regenerate. When nephrons are damaged and lost, they do not grow back. Chronic kidney disease is defined as a progressive, irreversible decline in kidney function. The goal is always prevention, because treatment after significant damage is limited.
The Centers for Disease Control estimates that 37 million Americans have chronic kidney disease. Most of them do not know it. That number tells you everything you need to know about how silently this condition progresses. Now let me tell you what is causing it.
The number 1 hidden toxin destroying kidneys worldwide is excess sugar and refined carbohydrates. This is the one that is almost certainly in your kitchen right now. Here is the mechanism. When you consume large amounts of sugar and refined carbohydrates, your blood glucose rises rapidly. Your pancreas responds by releasing insulin. Over time, if this pattern repeats daily for years, your cells become resistant to insulin. Blood glucose stays elevated chronically. This is type 2 diabetes, or its precursor, prediabetes. Chronically elevated blood glucose damages the nephrons in your kidneys through a process called diabetic nephropathy. The glucose attaches to proteins in the blood vessel walls of the nephrons, causing inflammation and scarring. Scarred nephrons cannot filter properly, and because they cannot regenerate, that lost function is permanent.
According to the American Diabetes Association, diabetes is the leading cause of kidney failure in the United States. Approximately 1 in 3 adults with diabetes will develop kidney disease. Now here is what makes this particularly dangerous. You do not need to have a diabetes diagnosis for sugar to be harming your kidneys. Research published in the Journal of the American Society of Nephrology shows that even people with elevated blood sugar who have not yet been diagnosed with diabetes show measurable changes in kidney filtration rate. The sugar I am talking about is not just the white sugar you add to coffee. It is the sugar hidden in processed foods, salad dressings, sauces, flavored yogurts, breakfast cereals, and fruit juices. It is the refined carbohydrates in white bread, white rice, and pasta that spike blood glucose just as sharply as pure sugar. The Harvard School of Public Health research is clear. Diets high in added sugar and refined carbohydrates are independently associated with chronic kidney disease progression, even in people without diabetes. The protective action is straightforward. Reduce added sugar. Replace refined carbohydrates with whole grains, legumes, and vegetables. Keep your blood glucose stable. This single change has more protective impact on long-term kidney health than almost any other dietary intervention.
The second toxin is hidden sodium. And I want to be precise here because most people think they are managing their salt intake when they are not. The World Health Organization recommends less than 2,000 milligrams of sodium per day. The average person in the United States consumes approximately 3,400 milligrams. That is nearly double the safe limit. And the most important thing to understand is that the majority of that excess sodium does not come from the salt shaker on your table. It comes from processed and packaged food. Canned soups can contain 800 to 1,200 milligrams of sodium per serving. A single fast food meal can contain 2,000 milligrams alone. Bread, deli meats, cheese, condiments, frozen meals, and restaurant food are all heavily loaded with sodium that most people never account for. Here is what excess sodium does to your kidneys.
High sodium intake raises blood pressure by increasing fluid retention in the bloodstream. Your heart pumps harder. The pressure inside the fine blood vessels of your nephrons increases. Over years, that elevated pressure causes what nephrologists call hypertensive nephrosclerosis, the hardening and scarring of kidney tissue due to sustained high blood pressure. The American Heart Association has established this link clearly. High blood pressure is the second leading cause of kidney failure in the United States after diabetes. And the majority of high blood pressure cases are significantly driven by excess dietary sodium. The protective action is to read labels consistently. Anything above 200 milligrams of sodium per serving deserves your attention. Cook at home when possible. Use herbs, lemon juice, and spices to flavor food instead of salt. And if your doctor has told you your blood pressure is elevated, treat that information with the same urgency you would give a fire alarm. Because for your kidneys, it is.
The third toxin is one of the most widely used substances in medicine, and it is sitting in almost every medicine cabinet in the world. Non-steroidal anti-inflammatory drugs. NSAIDs. Ibuprofen, naproxen, aspirin in high doses, and their prescription equivalents. NSAIDs work by blocking prostaglandins, which are compounds that cause inflammation and pain. But prostaglandins also play an important role in maintaining blood flow to the kidneys. When you take NSAIDs, especially regularly, you reduce blood flow to the kidney tissue. Less blood flow means less oxygen and nutrient delivery to the nephrons. Over time, this causes a progressive deterioration in kidney function. The Mayo Clinic is direct about this risk. Regular use of NSAIDs, defined as more than 10 days per month, is associated with analgesic nephropathy, a form of kidney damage caused specifically by these medications.
The risk is significantly higher in people over 60, in people who are already mildly dehydrated, and in people who have any pre-existing reduction in kidney function. These are precisely the people who most commonly reach for ibuprofen for arthritis, back pain, and joint inflammation. I am not telling you never to take ibuprofen. Occasional use at appropriate doses is generally safe for people with healthy kidneys. But if you are taking NSAIDs regularly, your kidneys are being stressed with every dose, and you may not know it until significant damage has already occurred. The protective action is to speak with your doctor about alternatives for chronic pain management. Acetaminophen, taken correctly within the recommended dose, is significantly easier on the kidneys. Physical therapy, topical anti-inflammatory creams, and other non-NSAID approaches should be explored before defaulting to daily ibuprofen. And if you do use NSAIDs occasionally, stay well hydrated on those days. Dehydration combined with NSAIDs is a particularly damaging combination for kidney tissue.
The fourth toxin on this list is not a food or a medication. It is a behavior. And it is one of the most under-recognized contributors to declining kidney health in people over 50. Prolonged sitting and chronic physical inactivity. Multiple large-scale studies, including research published in the Clinical Journal of the American Society of Nephrology, have found a statistically significant association between sedentary behavior and increased risk of chronic kidney disease, independent of other risk factors. The mechanism is multi-pathway. When you are physically inactive, blood glucose regulation becomes less efficient, increasing the metabolic load on the kidneys. Blood pressure management becomes harder. Circulation to the kidneys decreases, and the systemic inflammation that drives nephron damage increases. Think of it this way. Your kidneys rely on good circulation to receive the oxygen and nutrients they need to function. Physical movement keeps that circulation active and efficient. A body that sits for 8 or 10 hours a day, even a body that is otherwise not overweight and does not smoke, is placing its kidneys under a level of metabolic stress that accumulates over years. The protective action here is achievable for almost everyone. Research suggests that breaking up long periods of sitting with short walks, even 5 minutes every hour, significantly improves glucose regulation and blood pressure stability compared to unbroken sedentary periods. You do not need to run marathons. You need to interrupt stillness with movement consistently throughout your day. A 20 to 30-minute walk most days of the week has been shown in multiple studies to reduce chronic kidney disease risk meaningfully.
It is one of the most powerful kidney protective interventions available to you, and it costs nothing.
Let me bring this together into a clear, practical plan you can begin today. First, reduce your sugar and refined carbohydrate intake. Eliminate sugary drinks entirely. Replace white bread and white rice with whole grain alternatives. Check labels on packaged food for hidden added sugar. Keep your blood glucose stable and your insulin response low. This is your most powerful long-term kidney defense. Second, cut your hidden sodium. Stop adding salt at the table and focus instead on what is in the food before it reaches you. Read labels. Cook at home when you can. Aim for under 1,500 milligrams of sodium per day if you already have elevated blood pressure. Keep your blood pressure in a healthy range because your kidneys depend on it.
Third, use painkillers wisely. If you are taking ibuprofen or naproxen regularly for chronic pain, have a conversation with your doctor about safer long-term alternatives. Treat your kidneys with the same care you would give any organ you cannot replace, because you cannot replace them. Fourth, move every day. Get up from your chair, walk after meals, build movement into your daily structure. Your kidneys respond to circulation, and circulation responds to movement. This is not optional for long-term kidney health. It is essential. And fifth, stay hydrated. Water is the medium through which your kidneys do everything they do. Most adults over 60 are mildly dehydrated throughout the day without knowing it. Aim for 6 to 8 glasses of plain water daily. If your urine is dark yellow, you are not drinking enough. Pale straw color means your kidneys have what they need to do their job.
I also want to give you the warning signs that mean you should see a doctor without delay. Persistent fatigue that is not explained by poor sleep. Swelling in your ankles, feet, or around your eyes. Changes in urination, including going more or less frequently than usual, or seeing blood in your urine. Foam or bubbles in your urine, which can indicate protein leaking through damaged kidney filters. Persistent lower back pain near the kidney area. Difficulty concentrating or a sense of mental fog. None of these symptoms alone confirms kidney disease, but any of them, especially in combination, deserves a blood test that includes creatinine and GFR, which is your glomerular filtration rate, and a urine test to check for protein. These are simple, inexpensive tests that tell your doctor a great deal about where your kidney function stands.
If you are over 60, have diabetes, high blood pressure, or a family history of kidney disease, I would encourage you to ask your doctor for kidney function screening at your next annual visit if you have not already had one. Early detection changes outcomes dramatically. Late detection limits your options.
Your kidneys have been working for you every moment of your life without complaint and without asking for anything in return. The choices that protect them are not difficult. They are not expensive. They are simply choices that most people never make because nobody ever explained to them why those choices matter so much. You now have that explanation, and you can act on it starting today. Reduce the sugar. Watch the sodium. Respect the painkillers. Move your body. Drink your water. These 5 changes, done consistently, are among the most powerful things you can do to preserve your kidney function for the decades ahead. Your kidneys are irreplaceable. Treat them accordingly. I am Dr. Elizabeth Kavaler. Thank you for spending this time with me. I will see you in the next video.